Studios.
Approximately 10 million people experience a heart attack in India each year. So, what happens in a heart attack? Like any other muscle in our body, our heart needs oxygen, and during a heart attack, the oxygen is deficient. But what causes this deficiency of oxygen? Fatty deposits, or plaques, develop on the walls of the coronary arteries. These are the arteries that supply oxygenated blood to the heart for its normal functioning. These plaques grow over time and can eventually cause blockages. If one of the plaque ruptures or cracks, a blood clot is formed around it within minutes. Soon, a partially flowing artery can become completely blocked. Blood flow to the cardiac muscle is cut off, and oxygen-starved cells die within minutes. This is called a myocardial infarction or heart attack. Health can rapidly worsen if adequate treatment is not given. The injured muscle may not be able to pump as much blood. A huge myocardial infarction may even lead to sudden death. But how do you know if somebody's having a heart attack? Oxygen-deprived heart muscles cause a typical crushing type of chest pain, which lasts more than 20 minutes. The pain may radiate to the left shoulder and arm, jaw, back, and even stomach. But it is not as dramatic as shown in Bollywood movies. People may also experience nausea, vomiting, sweating, and shortness of breath. Symptoms may be less prominent in women and the elderly. They may just complain of weakness and tiredness. Interestingly, in many people, especially diabetics, heart attacks can be silent as their nerves are damaged, and these nerves carry pain signals. So, what should you do if you see somebody having a heart attack? You need to stay calm and respond quickly. Call emergency services. Dial 102 if you're in India. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. So, how do doctors diagnose a heart attack? Doctors use an electrocardiogram or ECG to measure the heart's electrical activity, a blood test to assess the heart's muscle damage. The patient is then taken to a path lab where tests are done to locate the blockages. Cardiologists can reopen the blocked artery using a balloon by a procedure called Angioplasty. They may also insert a stent made up of a metal or polymer to keep the arteries open. More extensive blockage may require coronary artery bypass surgery, also known as CABG. Using an artery or vein from other parts of the body, a heart surgeon can reroute the blood flow around the blockage. This re-establishes the normal circulation of the heart muscle and restores the heart's normal functioning. In heart attack, prevention is vital. Genetics and lifestyle factors both affect the risk, and lifestyle can be modified. Lifestyle modifications like exercise, healthy diet, and weight loss can decrease the risk of heart attack. Exercise should involve both strength training and aerobic activity and keep your weight in a healthy range. A good diet for heart is low in saturated fats and sugar. So what should you eat? Eat fibers from vegetables and fruits, chicken and fish, whole grains and nuts like walnuts and almonds. Avoid smoking and tobacco. Plenty of sleep and lots of laughter helps keep the heart in top-notch condition. Medications like low-dose aspirin are prescribed to patients who have had previous heart attacks and people known to be at high risk. Drugs that manage high-risk factors like diabetes, high cholesterol, and high blood pressure make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable.